my years of treating patients with melasma, I sometimes uncover some of the habits and sometimes some of these mistakes that patients commonly make during their journey with melasma. So these mistakes include inconsistent sun protection. Many of us actually don't have the habit of using sun protection until we start to see pigmentation form on our skin. Unfortunately, most of us actually accumulate our sun damage when we are a lot younger, in our teenage years, in our school years, where we are most likely to be in the sun unprotected. So unfortunately, that contributes a lot to poor melasma control. The second factor would be the use of potentially irritating skincare. There is a lot of information out there, a lot of different products out there. So patients go through different types of products which social media tells them it's useful for their skin. So for example, things like peels or very strong retinoids. Some of these have theoretical benefits for melasma, but they may not be suitable for Asian skin type or for that particular skin type if they have sensitive skin, for example. The third factor would be the overuse or the misuse of hydroquinone. If we go online and we search depigmenting agents or lightening creams, hydroquinone does come out a lot. And of course, hydroquinone potentially gives very good initial results of lightening and depigmenting along with other treatments, but unfortunately, hydroquinone is not an ingredient that we can use for a long period of time, because we know that in prolonged use of hydroquinone, we potentially irritate the skin, and that could actually worsen melasma. And in darker skin types, we do see this phenomenon called ochronosis, which is basically a condition in which prolonged use of hydroquinone causes a bluish discoloration of the skin. And this is more common than people think it is. The next factor is an inconsistent treatment routine. In order to control and treat melasma well, we need to be very consistent over a period of time. This is the same as any chronic condition such as hypertension or diabetes. The treatment needs to be consistent and needs to be sustainable. So any treatment regime that you embark on needs to be consistent over a period of time, and we were talking about months and years of treatment, including a good skincare routine, including potentially seeking treatment from your professional, and also in terms of lifestyle modifications as well. So there's nothing wrong in starting a little bit of self-treatment when you first notice signs of melasma. So for example, being consistent with your skincare routine, being good with your sunscreen. But beyond these measures that you implement yourself, if you continue to struggle with your melasma control, or if it's starting to get even darker, do seek the help of a professional who has experience in treating melasma.